Hello and welcome back to Blueprint to Heal. Dr. Larry Miller and Dr. Miller owns Hearthstone Family Care right outside of Philadelphia. Welcome back.
Thank you, Nancy. Great to be here.
So today's topic is hormones. This is like the big thing in the news right now that the FDA is removing the warning on the hormone replacement therapy, otherwise known as HRT. So we thought we would talk about that because, as a family practitioner, you obviously have a lot of experience working with that. And, you can also share some insights into HRT versus bioidentical and then other things you can do too.
Sure, absolutely. So, yes, hormone replacement therapy the big concern, let me state this. The FDA just came out a couple of weeks ago about removing the black box warning for HRT or hormone replacement therapy. And what happened was back in 2002, there was a study known as the WHI, the Women's Health Initiative. And back then, what happened was they were using high dose Premarin with progesterone on women that were an average age of 63. So, again, higher risk patients, higher dose estrogen, synthetic estrogen therapy. And what they found was that these women were having increased risk of heart attacks, blood clots going to the lungs, cancer. So the government at that time, after seeing this study, said, there has to be a stop to this study. And we're going to put a black box warning on hormone replacement therapy for those reasons. So fast forward now, 23 years, there's been a lot of discussion, in just health talks in general about the benefits of HRT, especially in younger women that are perimenopausal. We're talking women, from 40 to 50, mainly 10 years prior to menopause, about all of the benefits as far as the brain, the vasomotor symptoms, of course, like hot flashes, night sweats, vaginal dryness. But really the brain benefits and the bone, especially as far as osteoporosis prevention. And how it could even benefit heart disease and not cause clotting in the younger women. Again, we have to be careful as women are getting over 60, there does tend to be an increased risk from what they're seeing. But the study essentially was flawed because it was based upon, again, higher dose estrogen and older women that were being studied.
And you're not suggesting everybody just go out and go on HRT now.
Absolutely not. So it really has to be personalized. And it's really I mean, the patient has to be comfortable with it. So what we have to do is weigh the risk versus benefit ratio, with treatment. And then there's still synthetic and there's a bioidentical treatment that's been FDA approved. So that's similar to our own biology, how our body's making estrogen and progesterone. And then there are the compounded versions, where we could personalize that even more going to a compounding pharmacy, even though that is not FDA approved, but it's something that can be tailored. But so those are the options, and yeah, it's not for everyone. So for women that have had a history of blood clotting, heart attacks, strokes, pulmonary emboli, or DVTs, or thick blood, a hypercoagulable state, those are women we're not going to recommend most likely going on the HRT, or with a strong family history of cancer or personal history of one of the estrogen receptor cancers, such as uterine and breast cancer.
And it just makes me wonder. So this is where my brain goes when I hear you talking. One of the things that happens is, unless you have a history, a family history or personal history, but I think you know as well as I that you could be the first. So even though there's no family history, it doesn't mean that it's totally safe, right?
Right.
And I'm not saying that to be a fear monger or, scare people. I say that from the perspective of, what other options do you have that you can try first? So like that's always where my brain goes when it comes to, medical pharmaceutical intervention. And, I have to wonder, like, the timing of this is questionable to me. Like, do you think that, and yeah, I don't want to put you on the spot here, but I just feel like, R.F. Kenny Jr. is really doing a lot to promote MAHA, Make America Healthy Again. And, you and I both know that there's a lot that can be done just using specific whole foods and herbs and things like that to help women dealing with perimenopause and menopause. But I also feel like, is this kind of like a concession to pharma, because of all these other things that are being put under the microscope, like vaccines and stuff like that. And, they may be feeling like, oh, this is like kind of like grabbing away at their profits. So, and I hate to be the skeptic and the cynic, but, it comes from just seeing what they can do and how powerful they are.
Sure. I don't think in this case that that's the situation. There's been a lot of pushback from the medical community, just saying like, yeah, why do we have black box? Because you feel like if you're prescribing these with a black box, it's concerning. So a lot of physicians are just like, or providers, I don't want to take any risk. Like when that study came out, I remember like I was prescribing HRT more frequently. And when I saw that, I'm like, oh, forget it. It's not worth the risk. Not for women, but just in general. You're like, well, if the guidelines are now recommending not doing that, you're typically going to comply with that. But now I think that many of like OBG, many of the more common prescribers of HRT, like OBGYNs, or family docs, internists, are just saying like, hey, there are many benefits, many more studies that are showing benefits of these. Why can't we use this possibly as a tool with all the natural approaches as well? Because there are many women that do fail going through lifestyle interventions. And what's happening is their body is just the metabolism is changing. They're going into this state of insulin resistance where their body is just not metabolizing the fuel that it's taking in properly. And then it's causing more of this inflammatory response, which then leads to many of these symptoms and can cause just decimation of the metabolism, leading to diabetes, hyperlipidemia, or high cholesterol, high blood pressure. And then you have all the symptoms on top of that, the memory loss, the brain fog, the fatigue, the sweating. So I think they started with, like, I believe that the medical community and even the public, there was more of an outcry after there was more education about this over the last 20 some odd years to say, like, why can't we have this? Let's reassess what's going on. Like maybe we shouldn't be using this study as like the landmark basis for what we're doing. It was again, it was more of a flawed study with the age and the dose of synthetic estrogen. Maybe we need to reassess this and take the black box away because we're really limiting its use based upon that.
Yeah, and I do want to reiterate, possibly look at bioidenticals first, things that are, more natural and safer to the body. But I do want to share with you that when I was 44, I was actually living in Asheville, North Carolina at the time, and I started getting severe issues with memory and brain fog. And I had a very busy practice there. Yeah, I'm a chiropractor. And I would go into the market, the supermarket to go food shopping, and I would bump into people there, and I'm like, oh, I know that person, but I just can't place them. I definitely couldn't know their name. And they would come up to me and say, hi, Dr. Tarlow, how you doing? I'd be like, oh, I'm great. How are you? Like I felt so bad. I had no idea what their names were or even how I knew them. And I was even at a wedding where, and this is so embarrassing for me to share this, but I was at a wedding and the massage therapist who was working out of my practice at that time was there and she was across the way. And I'm like, I said to my husband, I'm like, she looks really familiar. Like, here's a woman I was seeing several times a week in my practice, and I couldn't remember how I knew her or what her name was. And, my husband's like, she's a massage therapist working at your practice. And I'm like, oh my God, like I thought I was getting Alzheimer's or dementia. And it came on suddenly. It was just something out of the blue. And we had a natural pharmacy in town that was owned by two pharmacists that were doing just all natural stuff. They were doing bioidentical before, like, I think the more mainstream people were doing it. And, I knew the both of them pretty well because I would pop in there to get all my supplements. And I say, I'm dealing with these symptoms. And honestly, I don't even remember if I was dealing with any kind of hot flashes. I don't think that my period was irregular. It was just really this memory issue. And the pharmacist said to me, you could be perimenopausal. You might, even though you're only 44. And I was active. I was in amazing condition. I was hiking these huge mountains, like in phenomenal shape. So it's not like I wasn't getting enough exercise. And anyway, so he said, you can either get this test here for like $225. Don't ask me why I still remember the price. Or you could try this natural progesterone cream, take it 2 weeks on, 2 weeks off. He told me how to do it. And lo and behold, I mean, everything reversed almost immediately. Within a week, I had no more memory issues. It was gone. And I started sleeping better because I my sleep had always been an issue for me since I was, about 11 or 12. So I started sleeping better. I felt like there was a sharpness. I could remember things like before I had to put everything down, the dates, like if I had appointments, everything had to be written down. All of a sudden I'm remembering things off the top of my head. Like huge difference. And as I said, I was 44. Within 6 weeks I was pregnant. Which, as you probably know, 44-year-old getting pregnant who's like not even trying is pretty big. And so,
Yeah.
that's the benefit of, using natural progesterone cream. And I'm not advocating for it. I'm just sharing my personal experience. But, back to my age and getting pregnant, it was funny because my ex, he and his wife had been trying to get pregnant for a few years, and they were trying all these things. And she was younger than me. And through the grapevine, he had heard that I was pregnant, and he called me up out of the blue. And that was before caller ID, right? So,
Right.
like, I had no idea who was calling me. He goes, do you know you've got a better shot at getting hit by lightning than you do of getting pregnant at your age? I'm like, God. Hi, Steve. It's nice to talk to you too. So, so that's, my little anecdote to share because
Yes.
it's true. Like, this was something so simple. And had I not walked into that pharmacy and he was just so perceptive and he's like, oh, you're at the right age. This is probably, perimenopausal. And I was lucky. I mean, it could have been something, it could have taken me years to figure out.
Yes. Wow. Incredible.
So,
Yeah, and now they're recommending again starting early with women. So even 10 years before menopause, with the average age of menopause being about 51. So 41, starting to have that conversation, at least like, hey, are you having any of these symptoms? And why suffer through it? And then again, it's personalizing and weighing it to see if it's going to be the right fit.
so how would you, like, what would your approach be to try to determine if there was a hormonal imbalance? Like, what are the tools that you use?
Right. So most importantly, it's going to be the history. So just discussing like when did this change occur? Because many women will say, "Yeah, I noticed, over the last like 6 months, and there was no other specific trigger. It's not like they had an infection or there was any other stressor. They'll just say, "Hey, my body's, I feel like it's going through changes." Some of those symptoms we discussed, like brain fog, memory loss, like you mentioned, the hot flashes, the majority of women have those. Some of them will just say, hey, I can't lose weight. I feel like I look at food and I gain weight. My metabolism just, I feel more sluggish, just don't feel like I did previously. And often that's enough. I mean, we'll rule out other things, just to make sure it's not an underactive thyroid, for instance, or some vitamin or mineral imbalance or any other autoimmune disorder. But then it's a matter of, can you do some hormone testing to help further assess that? Now, the blood hormone testing doesn't usually give you enough information until you're really postmenopausal. When you're at that level, you'll see a hormone known as follicular stimulating hormone, FSH. Estrogen will get depleted from the uterus, or I'm sorry, your ovaries. You're not going to be producing that, and then it's going to send a feedback signal to the brain, the pituitary in your brain, to produce more of this FSH to try and stimulate the ovaries to produce more estrogen. It goes back and forth. So your FSH level will be very high when you're in menopause, but when you're perimenopausal, that level could be normal. So you could do a Dutch test, which will just give us over 30 days what's going on with your hormone, just really a smattering of what's happening, just a better perspective than just a one-time blood draw. So that can be helpful. But most importantly, Nancy, I would say it's really the history. We're not usually going to pick up much on a physical exam. And even if you do imaging of the ovaries, you're not really going to pick up a whole lot. So
But the Dutch test will also help you identify if you are going to recommend bioidentical, right, what the percentages of each should be in the formula.
that's right. Yeah, yeah, it can really help you tailor, treatment for that. That's
Yeah.
right.
Yeah, and the Dutch test. So I had done the Dutch test at one point, 30 days. So it's dried urine test. I don't remember what the CH stands for.
Something hormones. Yeah, dry
Yeah.
urine testing. I forget what the C is, but yeah, Dutch urine. Yeah, dry urine testing, something hormones.
So they basically give you these little pieces of paper and you pee on them. Like I think you have to let a little bit go. You don't want to get the first couple seconds of the stream and then you pee on it and then then you send them and you do that for 30 days. I think you even do a certain time of day. It's been a while since I've done it. And
That's right.
then you mail it in and you get this incredible report. It's not just your hormones. I think it also gives you like minerals and like it
Yeah,
can really give you so much information. And because it's not a blood draw,
yeah,
you're getting a better idea of, what that person's physiology is based upon
yeah.
30 days rather than like a 10-second moment in time.
Right. It's comprehensive for sure.
Yeah.
So
I
yeah,
mean, I
yeah.
think it's good for somebody who just even wants to do it for themselves and, get an idea of what's going on. And you can also do the 3-day, right? You don't have
Mhm.
to do the 30-day.
Correct. You can do a shorter version of it. That's right. Yeah. Again, you don't need the testing. It just helps to tailor the treatment, though. But sometimes just based on the history, you'll be able to tell, and then you could gauge it from there.
Yeah. So I also wanted to talk about, as a chiropractor, right? I mean, I could do, I can recommend supplements. So I could recommend, natural progesterone cream and, specific foods. But, coming from my background, it's always what's the least invasive first. So the least invasive is getting a chiropractic adjustment. So, the chiropractor, just to have a little bit of an understanding, chiropractic can work on the body in a couple ways. One is if stress is the thing that's causing this hormonal imbalance, which is definitely a cause of hormonal imbalance, if you had a technique like Logan Basic, network, spinal analysis, there are techniques that are designed to shift you from this chronic fight or flight state into the relaxation response, bringing back that parasympathetic nervous system to help return it to balance. So it's called a tonal technique. Those aren't the only two, but if you're looking to try chiropractic first, and if you know that if you're in a constant state of fight or flight and or just a lot and you're having other symptoms like, elevated heart rate, respiration, your hands are cold and dry, that is a sign that you're in a chronic hypersympathetic state. But the other way it helps, there are two other ways. One is the upper cervicals. All the nerves go to every part of the body, they come out of the brain. but there are certain ones that go back into the brain, and that can affect the pituitary, right? Which is where, one of the places we make hormones for the body. So that's very helpful to get checked if you have chronic neck pain. If you know that upper part of your neck just feels stuck a lot, that could be a great option to try first. The lower lumbars, like L3, the nerves from there go to the ovaries, which again is another place we make hormones. And then I also like doing cranial work. So the pituitary sits on the sphenoid, which is a bone that goes from, it's got these wings and they go to like that little indentation in your skull on the right. And if you push on there and it's tender, your sphenoid might be stuck. So if you go to somebody who does cranial work and can gently, very gently get that bone moving the way it should. And I realize I'm talking in, like I'm not using sophisticated medical lingo, but I want you to understand like how easy this is to get it to move properly. And then the pituitary then can hopefully restore that balance. So like from my perspective, I always come from that first and then maybe working on stress reduction, like doing some deep belly breathing to really work on, if you find that your hands are cold, you can focus on getting your hands warm, use it like a little biofeedback technique. So these are really wonderful ways of helping to restore the body naturally without getting into any other interventions.
Right. And also the lifestyle interventions, like you mentioned, stress reduction, diet is very important. Just going whole foods diet, minimizing processed foods, healthy fats, trying to minimize or avoid seed oils, anything that's going to, again, cause more inflammation in the body is going to dysregulate that hormonal balance. Good night's sleep, at least 7 hours. Minimizing toxin exposure, making sure your water, it's filtered, whether it's reverse osmosis, making sure you have good air quality, good social relationships. Um, all of those things are very beneficial. And I always like to approach it that way first prior to adding supplements or medications. And a big fan of, chiropractic therapy, osteopathic manipulation also, adjunctively. So,
Yeah, always start with the least invasive first.
mhm.
And because I mean, I know that once you start playing around with hormones, even bioidentical, it's going to be tricky and finding the right formula. And, I know that for years I know people that have really struggled, but a lot of times it's just so basic, as you said, like eating organic whole foods and, feeding the body the nutrients it needs and getting out and walking, like doing things to reduce
Yeah,
stress, like putting the phone away, because even the EMF from the phone can
sure.
disrupt things, but also the stress of, the doom scrolling, as they call it, or watching the news that feed that stress.
Yeah. And back to exercise that you mentioned, great call. So many women I found are not doing resistance exercise. They're just focused on cardio. And you need to build muscle, not just for power, so we don't have frailty, as we get older, but really the muscle is the key to metabolism. So the more muscle you have, the better your body's going to be able to regulate the energy that you're consuming, and then it's going to help balance out your hormones so they're not getting dysregulated as readily, and help it's going to help your body cope when it is starting to transition towards perimenopause and then menopause. So having those foundational elements are really paramount.
Yeah, and I do want to mention that one of the things is the type of exercise is important, but also, back in the day, aerobics was such a big deal. Like, they could do these aerobics classes. And a lot of people that were having weight issues that I worked with were very, very stressed out. And they're like, I just got to work harder in my aerobics class. But they also didn't understand this concept of burning the candle at both ends. That what they really needed was more of a yoga practice or restorative practice because they had adrenal fatigue. They were exhausted, and they just kept pushing and pushing, and that was actually increasing the cortisol. They find that they were gaining weight rather than
Yeah.
losing because they just thought, well, if I just, run more or I work out more, it's going to be the cure, but it wasn't, you know.
Right, right. The exercise more, eat less. But yeah, the body adapts to that. When once you're starting to do that, that not only do the cortisol levels go up, but then the thyroid starts to dial back as well. And then it becomes your body says, "Oh, we don't need as much energy," and then it adjusts, and then you hit a plateau when it comes to weight loss. That's why that does not work for the majority of people. Eating less and exercising more. So there has to be a good balance there.
So when you talk about like strength training, do you have specific recommendations you make, or do you recommend people go to like a gym and work with a personal trainer, or how do you handle that?
No, that's a great question. So I'm not that I'm a personal trainer, but somebody that has experience, like somebody that's let's see, somebody that's in the younger age group, of course, they're not as vulnerable to injury. And if they felt comfortable using weights, I'll say, yeah, let's start with dumbbells, whether they like going to the gym or doing it at home. It's going to depend on what setting they like to work out. So if they like going to the gym, it may be, hey, work with a personal trainer, once or twice, let them show you the exercises. And then after that, you'll be able to do all the body parts because you want to be able to do a full body workout. You want to work on your biceps, triceps, chest, back, legs, shoulders. It's important to build all those muscles. And a lot of people forget about their leg. Legs are probably the most important, but so many people are focused like, I want to just get a big chest, big arms. Legs, that's where the majority of our musculature in our trunk. So very important to focus on those, or just include that as part of your regimen. Um, but yeah, for people that are older, like some of our seniors that are, a little bit more uncomfortable. They haven't used weights before. We'll say start at home, like with very light dumbbells, and I'll show them, how to do biceps and chest work. I mean, some things are hard if you don't have a bench or you don't have the equipment, but you don't even need that. Just very basic stuff. And there are many YouTube videos out there. Again, some of the seniors are not looking to go online to find them. So we'll talk through them if they're willing to do it at home. But if not, then it's going to the gym and working with a personal trainer. But I feel full body at least like at least twice a week, and that can be broken down into different body parts or doing the full body each day. So you want to try and get like each body part in during that week.
That's great. So I do want to mention we're not going to be covering these things today, but I do want to mention there are other things like using herbs, homeopathy, acupuncture is a really great option because it'll open up these channels, the meridians. I'm a huge fan of I'm actually a huge fan of herbs and homeopathy. So I love it. I will try everything natural first,
Mhm.
but there's a time and a place for everything. And it's working with somebody like Dr. Miller, will give you that. I can tell you, it will give you the confidence that he's going to look out for you and do the right thing and not just jump into prescribing, even bioidenticals, as you said.
Absolutely, Nancy. It's not the first tool it's one tool in the toolbox, but it's not the first one. I mean, if somebody's really struggling and we feel like we need to assuage the body because it appears to be a hormonal imbalance related to perimenopause. And if somebody's been doing everything already, I mean, some people are like, yeah, I'm exercising, I'm eating whole foods, I'm sleeping well, I'm not stressed, no toxins in that. Say, all right, you're trying, they tried supplements. All right, maybe we're going to start with that sooner rather than waiting. But no, it's not the place that most people want to go is because look, there's always the potential for adverse effects. So that's where we always have to weigh it.
Yeah. Okay, we're going to stop here. Thank you so much. If you have any questions for anybody listening or watching, put them in the comments and tag me on that, and one of us will get back to you with an answer. I mean, unless it's something that you really need a consultation with. But thank you, Dr. Miller. It was great to talk to you again.
Oh, you as well. Thank you so much for having me, Nancy.